Mr. Speaker, dignified care for elderly Manitobans must be a top priority. Today, I tell the story of a system breakdown and a communications breakdown in ensuring the dignified treatment of a 78-year-old man who was for 21 years a veteran in the Canadian Navy. This Manitoba citizen, as a result of this health system failure in the Interlake Eastern region, has seen a huge injustice and rapid deterioration of his mental and physical health. With his son and daughter-in-law in the gallery today, I ask the Minister of Health, will she investigate the situation of Mr. Percy Loster and ensure this system failure, which is occurring under her watch, is addressed immediately?
Thank you very much, Mr. Speaker. If the honourable member wants to share those details with me after question period, I will take that information and we will ensure that the case that he is referencing is looked into.
Mr. Speaker, I will do that, but it's important to know that the unacceptable care of Mr. Percy Loster has been associated with very poor communication at numerous steps along the way. Mr. Loster's son, Robert, and his daughter-in-law, Christine Loster, who are both experienced healthcare aides with 12 and 20 years' experience, respectively, have been unable to obtain basic details of Mr. Loster's care. At one point at a time when he was walking and healthy at home, Mr. Loster was taken away by the police and put in hospital where his health has gone down rapidly. Mr. Speaker, I ask the Minister to ensure that the poor communication with the family is addressed quickly, as it's contributing to the high level of stress and concern of family members.
Thank you, Mr. Speaker. I also want to welcome the individuals that are here with us, thank them for their work in the healthcare system. As I said previously, if the member wants to give me those details. I'm not going to discuss people's confidential health information on the floor of the legislature. If the member wants to give me those details, Mr. Speaker, I will of course ensure that they are looked into. If there have been issues with communication, then we will look into that and we will make sure that those are remedied.
Mr. Speaker, it's important to know that the family called for help to the Minister of Health's office 4 times and never received the help or the follow-up that they were promised.
That's normal.
2 days ago, the family learned that the guardianship of Mr. Percy Loster has been taken over by the public trustee, without any discussion with the family, in spite of the fact that Mr. Loster's son has the power of attorney for his father.
Where's their MLA?
Surely, Mr. Speaker, when there are capable family members available and they're in agreement, the public trustee should at the very least undertake a proper consultation and discussion with family members before proceeding in this fashion. I ask the Minister of Justice, will he look into this situation immediately and ensure the concerns of the family are heard and acted upon?
Thank you very much, Mr. Speaker. It sounds like from what the member is saying, there are several issues here that need to be addressed. I'll be pleased to get that information. I'll be pleased to offer the people who are here in the gallery a meeting with staff that can help address some of the questions and concerns that they have this afternoon, if that would help.